Good afternoon, everyone. I'm Michelle Easton, president of the Claire Booth Luce Policy Institute, and I want to welcome you all to the July Conservative Women's Network. I want to thank you all for joining us today, and a special thanks to our partner, the Heritage Foundation, and Bridget Wagner here, who's been co-hosting this with us for years, many years. We are so happy today to have two experts to give us an update on the problems plaguing Obamacare and the path to repealing it. First up is Christie Herrera, the Vice President of Policy at the Foundation for Government Accountability. Previously, Christie served as Director of the Health and Human Services Task Force at the American Legislative Exchange Council, ALEC. She's been a key figure in galvanizing state pushback against the harmful effects of Obamacare, also known as the Affordable Care Act. Christie has testified before Congress and legislative committees in 27 states, and she's been a featured speaker to legislative caucuses, nonprofit organizations, and business groups all across the country. Her policy work has been covered by the New York Times, the Washington Post, the Wall Street Journal, and Fox News Channel, to name just a few. We're also delighted to have Grace Marie Turner with us, the president of the Galen Institute. The Galen Institute is a public policy research organization that she founded in 1995 to promote an informed debate over free market ideas for health reform. Grace Marie has been instrumental in developing ideas that transfer power over healthcare decisions to doctors and to patients. She speaks and writes extensively about incentives to promote a more competitive, patient-centered marketplace in the health sector. She's a co-author of Why Obamacare is Wrong for America, and editor of Empowering Healthcare Consumers Through Tax Reform. She's been published in hundreds of major newspapers, featured on many radio and TV programs. I love your emails. I always read your emails when they come in. You know, you get a lot of emails, but I know that yours will always be informative and have something new in them. So please join me in welcoming today our panelists, Christie Herrera and Grace Marie Turner. You want to go first?
Christie's going to go first.
I'll go first.
Okay.
Thank you, Michelle, and thanks to all of you for being here. It's really great to be back among friends, among the Claire Booth Luce Policy Institute. When I graduated college and moved to DC, it was Luce programs like the Conservative Leadership Seminar up on the Hill and these CWN lunches that not only helped connect me with my peers, but it also really inspired me to launch a career in public policy. So at a Luce event, to be on this side of the podium is really a treat for me, so thank you. As Michelle mentioned, I do most of my health policy work on the ground in the States, even though I live in DC. And it's really interesting. Some of the people I meet around town either don't know or don't really care what's going on in the States. I mean, DC really, is it the center of the universe? I don't think so. What I've discovered is that what happens in the States really serves as a catalyst for what's going on here inside the Beltway. For one, state legislators often serve as a farm team for national leaders down the road. Now, I remembered when I attended Luce events in the 1990s, Michelle, you always used to say how important it was to educate emerging leaders early on in their careers, because after all, Hillary Clinton started out as a Goldwater girl. I say that all the time. Well, I think it's worth noting today, and especially with health policy, that some of our biggest healthcare champions like Nikki Haley, Marsha Blackburn, Kathy McMorris Rogers, all started out as state legislators. And of course, so did Barack Obama. More importantly, though, is not just the fact that states play as kind of like a farm team for national leaders, but also the fact that they are playing a huge role in keeping Obamacare on the ropes. Why is that? Well, thanks to the president's health law, states have no state sovereignty. The law uses billions of taxpayer dollars to coerce states to implement the major parts of Obamacare and, of course, share the blame with the feds once things start to go wrong. But the good news is this. The good news is that states are pushing back one at a time. Today, we have a limited amount of time, so I want to talk about the big news that's going on in state capitals all across the country, and that is the debate to expand Medicaid. You might remember that prior to last June's Supreme Court decision, Obamacare forced states to expand Medicaid to everyone up to 138% of the federal poverty level. Now, what does that mean? Many states have Medicaid waiting lists for folks that are intellectually or developmentally disabled because there's just no money in the system to begin with. And so what this expansion means is that more people, even able-bodied childless adults, will be put at the front of the line. But now the tables are turned, and at a time when Congress can't balance its own checkbook, the states have the option to reject Obamacare's Medicaid expansion and save nearly $1 trillion in federal entitlement spending over the next 10 years. I have to say the stakes are really high. The federal government is dangling literally hundreds of billions of dollars in front of governors to implement this law. Obamacare's architects relied on this Medicaid expansion to be the primary coverage mechanism for the ACA. Why? Because it moved the needle towards socialized medicine. Now hospitals are pouring millions of dollars into this Medicaid expansion fight, and they're threatening to shut their doors if they don't get their way. Here's how the federal government thought the states would handle Medicaid expansion. If you could cue the first slide. Okay, there it is. You can kind of read this map like a stoplight. Green means go toward Medicaid expansion. Red means stop. And those of us who work in the states know that no matter if they're Republican or Democrat, state lawmakers love what they call free federal money, even though it's coming out of our own pocketbooks. But here's the good news. This is what the prospects for Medicaid expansion look like today, thanks to the hard work of principled governors and legislators all across the country. Isn't that amazing? You saw that green map almost go away by half. Today, 25 states have rejected Obamacare's Medicaid expansion. That is astounding. Let me put it another way. Half of the states have stared down billions of dollars in federal subsidies and have said no thanks or not now. As Joe Biden would say, that is a big deal. And I can tell you that many of the legislators in these red states, they're committed to keeping it that way. Grace Marie and I often work together and go all over the country talking about Medicaid expansion, and we're always up against some leftist advocate, and they love to wrap themselves in moral arguments as to why we should expand Medicaid. But we as conservatives know that it is immoral to trap millions of Americans into a low-quality Medicaid program that is funded with dollars borrowed from our kids and grandkids. So how is it that so many of these states can stare down the barrel of Obamacare and win? It's because rejecting the Medicaid expansion makes sense for patients and for taxpayers. At FGA, we released a study looking at what happened when states, before Obamacare was even enacted, decided to expand Medicaid on their own. You know what happened to Arizona when it decided to expand Medicaid 12 years ago? The expansion cost much more than they expected. It enrolled more people than expected. It didn't help out hospitals at all. People showed up to the emergency room in droves. And it did not reduce the percentage of the uninsured. Does that all sound familiar? Well, yeah, it should, and it does, because today the same Medicaid expansion advocates are talking about those same arguments. Just as important as the policy consequences of implementing Obamacare at the state level are the political consequences. We are a Florida-based think tank. We do health policy work all across the country, and in February, we commissioned a poll asking voters about not only the policy consequences, but also the political implications for expanding Medicaid. And what we found is that 53% of all Florida voters, that is Republicans, Democrats, and independents, 53% said that they are less likely to support their state legislator if they voted for Medicaid expansion. For Republican primary voters, that number jumps to 71%. What does that mean? 7 in 10 Republican primaries voters in Florida said that they are less likely to vote for their state legislator if they implemented Obamacare and expanded Medicaid. A lot of our arguments often fall on deaf ears when we go into the states, but that political number is something that every lawmaker can understand. Before I turn things over to Grace Marie, one final thought. I remember that after the states filed their challenge to Obamacare, Congresswoman Debbie Wasserman Schultz, cue groan here, she was also a state legislator from Florida, and we're kind of happy to send her here to DC. Debbie Wasserman Schultz said that the state's challenge was, quote, grasping at straws, and she called the lawsuit a waste of taxpayer money. But fast forward 3 years later, no one could have predicted the situation that the Obama administration is in now. Half the states have rejected the Medicaid expansion. 34 states have declined to set up what are called state-based health insurance exchanges, which are new Obamacare bureaucracies designed to overregulate and then subsidize the purchase of health insurance. The bottom line is that each and every day, no matter what you hear in DC, in state capitals all across the country, Obamacare is on the ropes. We know that state leaders are on the front lines. They will continue to push back against the harmful effects of this law. And of course, let's all work together to enact real healthcare reform at the state level that will bring real results. Thank you.
Thank you so much, Christie. What a great perspective from the states. You want to sit or stand?
I'm going to stand.
Okay.
I can't see people over here. Hi, everybody. Thank you, Christie. That was really, thank you for your incredible work in the states. That really, they really are on the front lines in the battle against Obamacare, and thank you very much for your doing. Thank you, Michelle. Thank you, Bridget. Thank you, Heritage. Thank you for your coming and for your continued interest in this incredibly complex, monstrous, dangerous law. I'm going to talk about 3 quick things. Talk about the status of the law, where are we? Talk about implementation, where are we with that? And then talk about a little bit about some of the other battles, in addition to the states, the battles going on in the courts. This is not over yet, folks. There are still a lot of ways that this law will fail or be significantly altered. There was a vote last Wednesday, House of Representatives, on the employer mandate. And I had a chance to be outside the chambers of the House floor right during the 2 sequential votes. And I felt an energy around, oh my goodness, we can actually do something here that I have not felt since the election. You know, after the Supreme Court decision, after the 2012 elections, after it passed in the first place, it's been very hard to see what the path is. But when the president said over the 4th of July week that, you know, it's just really too hard to implement this mandate for employers, so we're going to absolve them for a year of the reporting requirements that are quite onerous. How many employees they have, how many of them are eligible for health insurance, what's the salary, what's the percentage of their salary they'd have to pay for health insurance, and they'd have to report this every month. And so they're saying, we don't have this facility to accept this information, you don't have the capacity to report it, therefore we're going to delay it for a year, even though the statute clearly says that the employer mandate is to take place in January 1 of 2014. So that is another, not the first, but another time that the administration is trying to rewrite the law because, gee, it's just really too hard to implement this, or we don't like that provision. Remember, it was passed as a draft anyway. This was never intended to be the final legislation. And so they're rewriting it as they go along without congressional authority. So the House decided, well, we don't like the employer mandate either, so we'll pass legislation to make it legal for you to delay this mandate for a year. The president issues a statement saying he'd veto it, that he'd veto the legislation, giving him the legal authority to do what he's doing illegally. So no wonder businesses are confused, right? And the House said, not only that, but we don't think we should just be giving businesses a pass. We want individuals to get a pass also from the individual mandate, the single most unpopular part of this law. A recent poll showed that only 12% of Americans think that the individual mandate should also go into effect if the employer mandate is delayed. So there's just not even a question here. So 33 Democrats voted with all but one Republican, and who I've now talked to find out what his idea was, Morgan Griffith of Virginia, voted to delay the employer mandate, and 22 Democrats voted with all but one Republican to delay the individual mandate. So you now have Democrats on the record, many of them, saying that they agree with the president that the employer mandate should be delayed, but not the individual mandate. I think it's going to be very interesting to go to their town hall meetings to see what their constituents have to say about that. The next legislation that the House is going to consider is legislation to get the IRS out of Obamacare. 46 new powers in Obamacare to the IRS to help implement and enforce this law. Unbelievable amount of information that they are going to collect, aggregate from various agencies, ultimately distribute subsidies. With what we know about the IRS and the politicization of this agency, it only makes sense that the administration, that Congress would say, we need to get the IRS out of here. I think that there are some ways that both of these pieces of legislation, I can't imagine this isn't going to pass. I can't imagine that the Senate, that there's not going to be a big push in the Senate to also try to get these provisions through. There are so many things in this law that are so bad, but we've got to start finding the path forward to begin to delay, defund, and dismantle this law. Our path through the election and the courts has been blocked. We have to use the legislative process, and for the first time, we actually have some momentum and some ideas about how we can move this forward. All Republican senators have signed a letter asking that the mandate bills come to the floor of the Senate for a vote. And then the administration once again decided, well, you know, all these forms, I have a piece out there, a Wall Street Journal article I wrote recently about the incredible intrusiveness of the information that they are going to be asking for people who apply for these subsidies. And, you know, the president bragged, you know, we've gotten it down from 21 pages to 3 pages. This is a very abbreviated form. One of the ways they got it down to 3 pages is by making the type so small and almost no room for answers. But if you're a family, part of the 21 pages were individual pages for family members. And they basically said, well, we're going to keep this form shorter. Just go and Xerox some extra pages for however many other family members you have. It's just crazy. But the president has said that we are now going to use the honor system for reporting on your income, your family size, your eligibility for these subsidies. That is another, I mean, we're talking hundreds of billions of taxpayer dollars that are at risk. Why can't we use the honor system for our taxes? Forget the W-2. Why do we just say, this is how much I made and here's how much I owe you? That's what they're doing here. Some of these subsidies are enormous. If you were a family at the lower end of the income scale eligible for subsidies in the exchanges, your subsidy could be worth $13,000 a year. If you report income that is lower than it really was, you will get a bigger subsidy. That subsidy goes to the insurance company to lower your premiums, the part of the premium you have to pay. If the IRS were to come back and say, well, you misstated your income and you got a $5,000, your insurance company got a $5,000 larger subsidy than it should have, you have to pay that money back. Good luck with that. So implementation, 3 dates. October 1, January 1, April 1. Haven't talked much about April 1, but that's going to be an important date. October 1 is when enrollment begins. I understand that the White House has all of the senior officials have a little card in their pocket with the countdown dates to October 1, when enrollment is supposed to be beginning. They have almost $700 million that they are going to be spending this summer and this fall to advertise Obamacare. We see it on some of the network and some of the cable shows, but a lot of this, 700 million, a lot of this is going into advertising. We're not seeing. There are a huge outreach in the Hispanic community. Telemundo, Univision, all of the outreach, and then we've got armies of navigators. These are many of them community organizers who are going out with these forms that ask people your social security number, your address, your employer, how much you make, your family size, where do you live. Put all this into a piece of paper, send it to somebody who's going to keyboard this in, and the state of California, which is all in implementing Obamacare, says, we are really worried about identity theft. None of these people are licensed. We have health insurers and insurance and brokers, they have to go through huge training to get certified because we know they're getting very private personal information from people. So there are many, many other problems to come with this law. The potential for fraud and the potential for identity theft are enormous. And then when you look at, one of the reasons that the insurance companies were all in supporting this law and helping to get it passed was because they saw the potential for getting all of the young, healthy people into the system who are currently not now by purchasing health insurance. They didn't want it, it's too expensive, we're young invincibles, we don't need this insurance. And the individual mandate was supposed to do this. Everybody, unless you can find some way you're exempt, another waiver, we'll have a Twitter feed, where's my waiver? If you're not exempt, you have to purchase government-approved health insurance. The first year, the fine is $95 for not purchasing this insurance. It goes up to $695 or 2.5% of your income by 2016. But the Wall Street Journal has a front page story today about what the subsidies look like that are supposed to help these healthy young people decide that they need to purchase health insurance. And there is a huge Organizing for America. This is not only campaign level spending on advertising for Obamacare. This is campaign level, get out the vote, get people to enroll in this coverage. So, but let me here's Wall Street Journal. Here's Tom Daly. He owns a bike shop. His income is $24,000 a year. He's 28 years old. He would get a $39 a month subsidy. His out-of-pocket costs for the cheapest plan would be $102. Similar issues. Jonathan Scarborough, bike mechanic, a lot of people working bike shop, makes $29,000 a year, is age 30, subsidy $0. He would have to pay $147 for the cheapest plan. And these plans have $6,000 deductibles a year. They still have to pay $45 to $65 every time they go see the doctor. $250 every time you go see the emergency room. This is with insurance. And so what are they saying? They're going to say, $95? I'm just paying it on my taxes. And by the way, if they're smart enough to file their taxes in a way that they don't have a refund due, no way the IRS is going to come after them. So a lot of people are not going to have their refunds, are not going to have tax refunds, because then it may take them a year for them to figure that out. But these subsidies are for the people they want to get in. These exchanges are not enough, even though they're still enormous. For the very people they most want in, they're not going to be enough to incentivize to enroll. So what you're going to see, I think, is exchanges that have the sicker, older people signing up. And in fact, you see little sporadic news reports of health insurance companies that have decided, gee, we're not going to participate in the exchange the first year. We're just going to wait for a year and see how it works out. They want to see who signs up. And if they wind up with older, sicker people that are going to cost much more than the subsidies, the premiums, the co-payments they have to pay, they're not coming in. There's something in the insurance industry called a death spiral. And that's where you wind up with people. New York is already there, by the way. New York has put so many insurance regulations on its insurance market that the premiums got higher and higher. The healthier people dropped out, then only sick people were there, so the premiums had to go higher still. More young people and healthy people dropped out. And so you really wind up with almost a collapse because the insurance just becomes too expensive for only the people who are very sick to afford. And by the way, on New York, the president keeps talking about New York, 50% lower premiums. It's a little like a store that says, we're going to mark everything up 100% and then tell everybody we're having a 50% sale. It's still the most expensive health insurance in the country. It's only less expensive because they've fouled up their market so much that it costs so much more. So quickly, because I want to get to your questions. So October 1, enrollment begins. January 1, the actual insurance begins and the subsidies begin to flow. It's a really crucial date. And if there is a way, and we are working night and day to figure out how do we stop that, there will be an effort through the continuing resolution to defund Obamacare entirely, through the mandates, the IRS, the potential for fraud, the fact that these exchanges may not be ready. I think there really is a chance, at least to delay it by time, for us to be able to push this into the next year and into election year, and then I think we can buy time to the presidential year. April 1, why is that such a crucial day? Because the law says that you have to, if you enroll in insurance, you can't be thrown out for 90 days, even if you don't pay your premium. So they may get a lot of people to enroll, but if they're not paying their premium, they're going to get thrown out on April 1. So that's going to be very interesting to see. Good. It's going to be a very different equation to ask somebody to sign up for to pay $147 a month for an insurance policy that they're not going to believe is very good, and to continue to do that for the rest of their lives. This is not just for a few months. This is not pulling a lever in a voting booth, which is what they think. They think, we got everybody mobilized to go vote. Very different than $147 a month for the rest of your life for insurance that's not very good. Finally, just two quick things about court battles. The religious liberty battles, there is absolutely no question in my mind that this is an unconstitutional infringement of religious liberty in the First Amendment of the Constitution, that to be able to not have to pay for contraceptives, abortion drugs, sterilization, that you have a moral objection to. Hobby Lobby, God bless them, are really fighting this battle and winning battles in the courts. They now have an injunction that they don't have to pay this fine. I think that's going to go up to the Supreme Court. And it is going to be very difficult for me to see how but then who knows? I'm not going to predict what the Supreme Court's going to do. And then finally, the federal exchanges. Tom Miller from the American Enterprise Institute has really been leading the charge in the lawsuit against the federal government's decision that, again, contrary to the law, it was going to allow subsidies to flow through federal exchanges, even though the law says, and federal exchanges, once again, as Christie said, the government didn't expect to have to create all these federal exchanges. They thought the states would do it. They now have to create 2/3 of these exchanges. The law specifically says that all of these subsidies, $1 trillion in subsidies, will go through the state exchanges. Doesn't say they can go through the federal exchanges. There's a lawsuit in Oklahoma. There's a lawsuit in federal district court here in Washington to challenge this. Once again, with the administration issuing regulations that are in clear violation of the statute and saying we want the subsidies to flow through these federal exchanges, which, by the way, we're going to know almost nothing about until the middle of September, when they're supposed to start operating on October 1, which makes me think we have not heard the last from the administration about these delays. So I'll leave it there and look forward to your questions. Thank you.
Thank you so much, ladies. What a great update and look toward the future. You know, the one thing I remember about insurance when I came to Washington 40 years ago is I was young and I was healthy, and I remember talking to my parents saying, why should I pay for this? I don't need it now. But they said, well, it's in case you get sick or you get in a car crash or something terrible happens to you. And so that was the reason a lot of us got insurance when we were young. But now, under Obamacare, no matter what your conditions are, your pre-existing conditions, they have to insure you. And they think young people are going to sign up now. This is going to be so interesting to watch. I mean, when you get older or you get married, you have kids, you need insurance. You know you need insurance. But when you're young, this is the big problem for Obamacare. You agree?
I do agree.
Yes. Well, enough from me. Why don't we have two Clare Boothe Luce interns. We have Andrea from University of Illinois, and we have one of our high school interns here, Madeline from Oakrest. And if you would raise your hand and give your name and your affiliation, if you have one. Thank you so much.
Hi, my name is Linda Kendall, and I'm just a concerned citizen. You know, I'm originally from Honduras, and the healthcare system works in a completely different way. And it's been a question in my head for the 20 years that I've lived here. What I would like to know is what is stopping the healthcare providers from the private industry from just directly offering services to any citizen, you know, with the caveat that, you know, you do so at your own risk, with a disclaimer, and allowing me, citizen, to establish a relationship with my doctor and keep it if I like him, without having to go through insurance and, you know, government mandated health care. I'm not.
Such a sensible idea. You know, maybe the two answers. First of all, a number of physicians are actually moving to a direct pay cash practice, some of them call concierge, where you pay a set fee every year and they become basically your personal doctor, and they will help you access specialists. You really do need catastrophic insurance with them. Most of them insist, because if you have to go to the hospital or you need expensive tests or expensive surgery, then that's not going to be part of your bill. So but they do provide basically the open door, and they become your access point to the healthcare system, and they can take care of a lot of things themselves. But the way that the federal government, state government, local government now pays about 50% of all healthcare bills in this country. And the way they have locked doctors in to providing, to participating in all these different programs, is if you are taking $1, taking care of one Medicare patient, you have to wait 2 years and go through a lot of legal work to extract yourself from Medicare, because they're so worried that the doctor's going to be paid twice, that you're going to get money from the patient and they're also going to bill the government for those services. And so doctors have to actively de-enroll from Medicare in particular. And a lot of doctors are afraid to do that because they're afraid their patients won't follow them. But you are seeing more and more doctors, particularly the good ones, going to concierge practices.
And I think that's the really funny thing about, not funny, haha, funny, terrible thing about the individual mandate. And that is when the government says that you have to purchase health insurance, the government then defines what health insurance is. So many people, as Grace Marie has just said, have this concierge direct pay arrangement with their doctors. Will Obamacare sanction that as health insurance? No, they won't. You would have to pay the fine or get another policy that would qualify as insurance, and then you would be okay. And this is the problem that's going on in Canada. Grace Marie has some great doctor contacts in Canada, and they always talk about how the single payer system there really threatens their ability to just contract with patients and make seeing your doctor like going to the car mechanic. The really interesting thing from a state perspective is 17 states have passed something called the Healthcare Freedom Act, something I was very involved with a couple of years ago. And what it is, it's a state constitutional amendment or a state law that says no matter what happens, we protect the right of patients to pay directly for medical care, and we protect the right of doctors to provide that care. So even if by some horrible accident we adopt Canadian-style single payer, 17 states now have something on their books ready to challenge the federal government because they say, we want to protect patients' healthcare freedom.
Is Virginia one of them?
Virginia is one of them. Yes.
Is there a question over here? Yes.
I'm Ashley. I'm a Hill staffer, and I work for an Arkansas congressman, and I'm from Arkansas. And so we did that whole private option thing, and we don't like it at all. But can you talk about the differences between that and the just straight up Medicaid expansion? And then the states that aren't doing that, are they doing something in place of that, or are they just not doing anything?
In March, Ed Heiselmeyer from Heritage and I did 6 town halls in Arkansas. We had a lot of great barbecue, so we really enjoyed that part, about the private option. And what this is, Arkansas, you might remember, was one of the bright spots of the 2012 election when things were kind of going to hell in a handbasket. Arkansas had the first Republican majorities in their legislature since Reconstruction. You know, in the South, I always talk about Reconstruction. Since Reconstruction. The problem is the first thing that the House Speaker and the Senate President decided to do was expand Medicaid. And we thought, did folks really just elect you? And did you get to this pinnacle of your political career to expand Medicaid with these huge Republican majorities? And what they did is they decided we're going to be cute about it. Instead of expanding the government-run Medicaid, we know is poor quality, a quarter of doctors don't take new Medicaid patients, we know it's bad. They said we're going to give these people private insurance. Now, how many of you have heard of something called crowd out? Crowd out, 1 or 2. Crowd out means that when the government expands, private enterprise contracts. And we see this every time the government expands one of its healthcare programs. People who had private insurance that they were paying for drop it to get on a government-run program. We've seen the traditional Medicaid program, CHIP, which is the state children's health insurance program, crowd out of 60%. So for every 10 people you sign up into Medicaid or CHIP, about 6 of them probably had private insurance and dropped it. Can you imagine the crowd out in Arkansas when they're moving from private health insurance that they pay for to private health insurance that the government pays for? Austin Fracht, who was one of President Obama's economic advisors, estimates 80% crowd out in that scenario. So for every 10 people you sign up to Medicaid, you're only paying for 2 newly insured folks because 8 of them had private insurance to begin with. I think I said the same thing when Vermont passed its Green Mountain Care, their single payer system. I can't wait for it to go into effect because I'm just going to sit back and have a glass of wine and just have all of my predictions come true. And I think the same is going to happen with Arkansas. When they go through with this private option, you will see massive crowd out. You will see huge electoral consequences at the ballot box. And frankly, the Republicans there deserve it.
But I also think that Arkansas, this is a 2-page, very loose agreement. The law, once again, do we pay attention to the law? I don't know. But the law says that any expansion of Medicaid can't cost more than traditional Medicaid would have. And so they're saying that we're going to put people on private plans, which can cost $2,000 to $3,000 a year more than Medicaid does, mostly because it pays doctors so little. they're not going to be able to do this. The numbers are not going to work. The problem with Arkansas, the Democratic governor agreed to do this in trying to do anything they could to convince as many states as possible to expand Medicaid, because they need the numbers to show their enrollment. But they made this agreement, and other states think, well, we want what Arkansas had. We want to put people on private plans and Medicaid. You can do that now. That's what Medicaid managed care is. This is not going to be any different, but it looks different, and therefore a lot of wayward governors, including Virginia, and Tennessee and others that, with Republican governors, are looking at the Arkansas model because they're thinking, well, maybe there's a way we can do this in giving people private insurance. But it really concerns me. We've got a paper, 12 reasons why expanding Medicaid is a bad idea. But I think the biggest reason is that this is going to harm the most vulnerable members of our society. People on Medicaid today that have no other option are now going to be competing with tens of millions more people to see the very few doctors that will treat Medicaid patients. A man wrote to me saying, my daughter's on Medicaid, she's handicapped, she's confined to a wheelchair. I need to make an appointment with her urologist. It'll take me 6 weeks to get an appointment. Don't they understand that if they put all these additional people on Medicaid, it's going to take me 3 months to get her appointment? And these are people who, many of them have private health insurance now. I testified on Tuesday before the House Education and Workforce Committee, and Jamie Richardson, who's a senior executive at White Castle Hamburgers, provide health insurance. They make it available to their employees. Their employees love it. Even this is a low-wage company. 25% of their workforce has been with them for 10 years, and health insurance is a large reason why. They are going to have to significantly cut back on health insurance. So you see people, and hours of their employees. So you're seeing people who are at the lower end of the economic income scale who are being harmed most by this law. And it is just unconscionable to me that we would allow this to happen, and people who are saying that they're doing it because they care about people. Care about the most vulnerable people, you would not do Obamacare.
Would you give your email, and you too, Christie,
Sure.
if you have one. She has wonderful emails. You probably do too. If you want to sign up, and you don't send too many. You just send just the right amount.
Grace Marie, all one word. It has a hyphen in real life, but Grace Marie at Galen.org. Or just go to our website and you can sign up for our email dispatches there. I used to be a journalist, and so I always try to say, how can I say this as concisely as possible with the least amount of jargon? So I really would love to have you in our circle. So Grace Marie at Galen.org goes to me directly, or go to Galen.org. Christie?
Sure. FGA's, our Project Medicaid Cure website is medicaidcure.org. We don't have an email, but we mostly deal with state lawmakers and governors directly. But if you're thinking about, I really want to keep tabs on healthcare policy, but I don't have a lot of time to read, I often tell my husband that reading everything that comes in about Obamacare is like a full-time job. You could spend 8 hours a day reading everything what's going on. Politico Pulse is a great morning email. It's free. Politico Pulse, P-U-L-S-E, and it's an aggregator of all of the Obamacare and healthcare news that goes on. Heritage's Morning Bell often has a lot of great healthcare stuff as well, and the Cato at Liberty website. Michael Cannon does a great job of keeping track of all of Obamacare's shenanigans.
Take Politico Pulse with a grain of salt. Kaiser Health News also is good, but really, the Heritage's Morning Bell is really one of the best, and I know Becky Norton Dunlop has really been involved in making sure that constituencies outside Capitol Hill have access to Heritage information, and that's a really, really wonderful product.
Let's give our last question to Becky Norton Dunlop here, and we'll talk informally during lunch.
Yes, thank you. Wonderful presentation. Question about your October 1 deadline. I know there's an effort to defund Obamacare through the CR. The numbers aren't exactly with us in the Senate. I know you're talking about this delay of the employer and the employee mandate in the House. So we work on both of these initiatives, defunding through the CR, which comes before October 1, delaying the employer and employee mandate. Tell us the likelihood of either of these things being successful. If they are successful, if the employer-employee delay is successful, does this mean that on October 1, all of these people whose employers are now, the delay is in place, are going to be leaping to sign up for Obamacare? In other words, talk to us a little bit about what's happening here. What's going to happen if these things either are successful or they're not successful? What can we expect?
Well, I have to tell you that last Wednesday night outside the House floor was the first time that we even really began to see a path to do something that really could to tear this, to really do damage to Obamacare. The employer mandate, and even more importantly, the individual mandate, are the center pole in this tent. If you pull that out, support absolutely collapses. And I think you're already starting to see labor unions incredibly upset. You've seen all the news reports, they were one of the most important constituencies to get this passed. They now are actually calling, some of them, for repeal, certainly delay, fix it. It's not going to get fixed. So I think that we have to look at Senator McConnell's cleverness with parliamentary procedure in the Senate. If there were a way that the individual mandate and the employer mandate delay, even though they were passed separately in the House, have been packaged together in one bill and sent over to the Senate. And if McConnell figures out a way to get those into a vote, it's going to be very difficult to see how 14 Democratic senators who are up for re-election, many of whom are facing the voters for the first time since they voted to enact this law. They're scared to death. And if they are forced to vote on a bill, whether it's freestanding or whether it's part of something else, must pass legislation that delays the employer and the individual mandate, I think you're going to start to see all of the people who are supporting this, including health insurance companies, running for the exits and demanding a delay of the whole thing. And if these federal exchanges that are supposed to come out in mid-September are not ready, then I think that there is a real chance this is just not ready for prime time. If we can delay this, the whole thing, the exchange subsidies, the mandates, the IRS enforcement for a year, that throws this into the 2014 elections, and then we are allowed to continue to have a conversation. The big thing that we've got to convince the American people is that we have ideas about how to fix this our own way. We don't have any 2,800-page bill that we think is better than the 2,800-page bill they passed. Speaker Boehner talks about a step-by-step approach to common sense reform with ideas that will fix Medicare, that will give people more freedom of choices in Medicaid as well as private health insurance, so that you can begin to offer substantive ideas that could be reasonable. And I think the American people, if we can show them we have better ideas, we understand there's a problem and we want to fix it, that they will listen more clearly and they will allow the delay to take place. But it's impossible to know how this is going to unfold. What do you think, Christie?
One last thing, unrelated to your point, Becky, but how many of you live in Virginia? Great. Let me tell you that the big battleground for Medicaid expansion is Virginia. You might remember that Governor McDonnell, in order to pass his transportation bill, abdicated the decision whether or not to expand Medicaid to something called the MERC, the Medicaid Innovation and Reform Commission. It is a commission with 5 House members and 5 Senate members. There are 3 Republicans and 2 Democrats on each side. And I had a chance to talk with some of the MERC members earlier in the week, and I can tell you, even the Republicans are leaning towards Medicaid expansion. So if you live in Virginia, as I do, as Becky does, as most of us do, merc.virginia.gov, mirc.virginia, spelled out .gov. They have meetings every 2 months. The next meeting is August 19th. Show up, call them, call your state legislator and say, tell Senator Hanger, who is the chair of the MERC, I don't want to expand Medicaid. out of all of the states and all the things that have happened, Virginia is now the battleground for Medicaid expansion. It is in our backyard. Imagine if we all showed up to the next Merck meeting and asked to speak. Wouldn't that be cool? So merck.virginia.gov. Please get involved, and I'd be happy to help you with talking points or whatever you might need if you do end up going.
They don't ever hear from us.
They don't.
They hear from community organizers and people who have a vested interest in these dollar flows. They don't hear from taxpayers and citizens who value our freedom, who do not want to confine millions more people to the worst health care program in the country, Medicaid, that we have better ideas and better solutions. So do let them hear from me. That's a wonderful idea, Christie.
I'm in. I saw somebody writing it down. We may have a contingent of Clare Boothe Luce ladies at the next meeting. I know, Grace and Christie, I speak on behalf of everyone here and just saying how very grateful we are to you, not only for coming and updating us, for traveling, for speaking. I'm sure you've had many a night on a scratchy hotel pillow and crummy food, but this fight is so essential for our country, and we just can't thank you enough for it. We have a couple of gifts. If you would
Wow.
stand up, yeah. First, from Luce, we have our limited edition Clare Boothe Luce Policy Institute coffee mugs with the famous saying of Clare Boothe Luce. What does she say?
No good deed goes unpunished.
There you go. We taught you well. Plus, we have our Clare Boothe Luce lady totes. Every lady needs a tote.
All right.
With our thanks to you.
And from Heritage, we have for each of you all, yes, copies of Democracy in America. Most of the wonderful conservative women know de Tocqueville wrote this book a couple hundred years ago, but he described the unique quality of Americans really stepping up, joining forces, making their communities better. And I can't really think of a better kind of representation than the women here in this room and the work that you all do for exactly that spirit that de Tocqueville described in Democracy in America. So we want to thank you so much for really educating us today on this. Thanks to the folks who joined us online. We were live streaming. We're going to archive this so you can send the link to the women who you're active with and educate them before the Merck meeting in Virginia. Also, our colleagues at Heritage Action are going to have a 9-city tour next month. Grace Marie mentioned the delay, defund, dismantle strategy, and Senator DeMint is going to be traveling all throughout the South and through some of the northern states to help educate the grassroots on how we can push back, delay, defund, dismantle Obamacare. So we hope you're all able to join us for that. But thank you for joining us today. And
Let me just mention one more thing, if I may.
Absolutely.
We have a big event tomorrow in Capitol Hill for interns and students. And we have Cleta Mitchell, Katie Pavish, Kate Obenstein, Amanda Collins, who's an NRA specialist, and we put in Lieutenant Colonel Alan West, because we promote women, but we like to have a man occasionally. This is tomorrow, and there's flyers outside, but it's for students, it's for interns, and if you or anybody you know might be interested, come join us. We have a few seats left.
great. Well, thank you all. We've got lunch outside, and we'd like to invite you to continue the conversation. So thanks.
That was excellent. We're going to put it up on the website.